Tēnā koutou katoa. Ko tarakea te maunga, ko opepe te awa, ko whakatohea ko ngaitirangi ngā iwi, ko ngaitamahaua ko tauwhao ngā hapū, ko ōpape te marae, ko Karen Brewer tōku ingoa. I'm Dr. Karen Brewer, a speech language therapist, and I'm going to talk to you about the communication problems you can get from having a stroke. A stroke is like a brain attack. It causes brain damage. When you have a stroke, it could damage any part of your brain. Each part of the brain does a different job. When part of the brain gets damaged, it's not able to do its job anymore. For example, if the part of your brain that controls your right arm gets damaged, you can't use your arm. It's not that the arm is broken, it's that the part of the brain that controls the arm is broken. So the movement messages are not getting through from the brain to the arm. Stroke can damage the part of the brain where the words are. This is called aphasia. Aphasia is a problem with using language. People with aphasia can still think clearly, and they just can't find the words to express the thoughts that they are having. They can use their mouth and their vocal cords, so talking is not a problem, but there's a problem with finding the words to actually say. Language is just not just about talking. Language consists of speaking, understanding what you hear, understanding what you read and reading aloud, writing, and using numbers, doing maths, using money, calendars, that kind of thing. People with aphasia are still intelligent and they still have good ideas. It's just hard to express themselves and understand conversations. If a stroke damages the part of the brain that controls speech, you can get a motor speech disorder like apraxia of speech or dysarthria. Apraxia of speech is when the message gets mixed up as it travels from your brain to your mouth. Your mouth doesn't move the way you want it to, and you're not able to say the word that's in your head. Dysarthria is when you have trouble with controlling some of the organs used for speech. It might be trouble with breathing, moving your vocal cords, your tongue, or your lips, so your speech is not clear. Your speech might be slurred or too quiet, or you might have an unusual tone of voice. Apraxia of speech and dysarthria are just problems with speech, not problems with language or the words that are in your head. People with apraxia of speech and dysarthria can still understand what everyone is saying to them, can still read and write. It's just hard to have their speech understood. If you have a stroke on the right side of your brain, you can get right hemisphere language disorder. People with right hemisphere language disorder can find it hard to understand non-verbal cues like facial expressions, tone of voice, and other social cues. People with right hemisphere language disorder are still intelligent. They just find it hard to follow the rules of communication. They might say inappropriate things or talk at the wrong time. Some people have more than one communication problem at the same time. They have problems with language and with speech. For example, it's quite common to have aphasia and apraxia of speech together. When you see a speech-language therapist, they will assess your speech and language and find out if you have any of these communication problems. Ngā mihi nui ki a koutou.